Our today's topic is about bones, the framework of life. Today we'll discuss about ossification and remodeling in bone disorders. Ossification, the process of forming new bone, occurs through two mechanisms: endochondral ossification and intramembranous ossification. Endochondral ossification involves the replacement of hyaline cartilage by osteoblasts, seen notably in bones like the femur. Conversely, intramembranous ossification condenses embryonic mesenchymal tissue directly into bone, forming flat bones such as the temporal bone and scapula. Both mechanisms initially produce primary bone, later replaced by mature secondary bone. Bone constantly undergoes remodeling where old bone is reabsorbed and new bone is formed. This process, vital for maintaining bone strength and integrity, is orchestrated by osteoclasts and osteoblasts. Osteoclasts break down bone through cutting cones, with reabsorbed nutrients utilized by osteoblasts to lay down new osteoid. Remodeling primarily occurs at sites of stress and damage, reinforcing affected areas. As a bone disorders, we'll discuss about osteogenesis imperfecta, osteoporosis, rickets or osteomalacia. Osteogenesis imperfecta, a rare genetic disorder, manifests with fragile bones, deformities, and blue sclera due to abnormal collagen synthesis. Osteoporosis, characterized by decreased bone density, increases fracture risk. There are three types of osteoporosis: are type 1, type 2, and type 3. Type 1 is also known as postmenopausal osteoporosis that develops in women after menopause due to decreased amount of estrogen production. Estrogen prevents osteoporosis by enhancing osteoblast and reducing osteoclast activity. Type 2 is known as senile osteoporosis that develops after age 70. It is caused by aging and can affect both men and women. Type 3 is known as secondary osteoporosis that develops when osteoporosis interact with another condition such as chronic renal failure. It is the failure of bone mass to form in growing skeleton, or loss of bone mass in juvenile or adult skeleton. Risk factors include age, gender, vitamin D or calcium deficiency, ethnicity, smoking, and immobility. It usually managed by bisphosphonates, which are taken up by osteoclast. Rickets, a childhood condition stemming from vitamin D or calcium deficiency, leads to poor mineralization and skeletal deformities. This figure shows the radiograph of a child affected with rickets. Similarly, osteomalacia in adults results from inadequate bone mineralization, predisposing individuals to fractures. Vitamin D lack can result from poor diet, lack of sunlight, or due to metabolic disease. For example, kidney failure may interact with vitamin D second hydroxylation, whereas intestinal issue may impede adequate absorption. Management of these disorders involves addressing underlying deficiencies or employing medications like bisphosphonates to regulate bone turnover. Understanding these conditions has effective treatment and safeguarding bone health throughout life.